All right, ladies and gentlemen, if we could ask the chambers to please come to order and ask the members of the Board of Supervisors to please take their places at the dais. Thank you all very much. And again, if folks could take their places here at the dais and or if the chambers could come to good order, and we will reconvene in our open session, and we will begin with the Pledge of Allegiance. So I'm going to ask you all to stand now that you've been seated, and ask Supervisor Ken Yeager to lead us in the pledge to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you all very much, and let me turn now to my colleague Supervisor Wasserman, who I believe is going to introduce an invocator of a somewhat unusual nature, and we're looking forward to it, Supervisor.
Thank you. It's my honor to invite Emma Gerson to the podium to meet me.
Ms. Gerson, welcome.
It's my honor today to share with you Emma Gerson. Los Gatos High School junior Emma Gerson won the Miss Silicon Valley Outstanding Teen Scholarship Competition in January. Her name is already known locally for her 2016 South Bay Teen Idol win, as well as the organizer of the Los Gatos Night of Stars benefit, where she and a group of Los Gatos juniors raised over $16,000 for the Peace Corps Let Girls Learn initiative, started by Michelle Obama. Emma recently led her school's walkout against gun violence and founded the, do I say this right, hashtag pre-reg?
Pre-reg 16.
Pre-reg 16 campaign, which assists students aged 16 and up to register to vote for the 2020 election. Emma compiled a book of teen artists and writers, including the United States Youth Poet Laureate Amanda Gorman, titled Don't Call Me Cutie, a message from American teenage girls, which drops in May. All proceeds will benefit Let Girls Learn organization. Emma is very grateful for the extensive opportunities she has received and wants to do everything she can to increase educational opportunities for girls and young women around the world. One of Emma's main goals is to help get girls who live in unsafe conditions and are victims of human trafficking to attend school. It is her lifetime goal to help send 1 million girls to school and to collaborate with others who want to do the same. She won the Silicon Valley Outstanding Teen Competition with her own original composition entitled Ready for a Change that she will sing for us today. Ladies and gentlemen, please welcome Emma.
Thank you. Every time I wake up, every day I understand. Even when the sky is dark, I gotta give it all I can. Every time I look around, I see people breaking down. I hold on to a hope for a better life, that with our hearts and with our hands we'll do what's right. I'm ready for a change, ready for a shining sun. I'm ready for the day when we can all just live as one. I'm ready for a change, ready for the sweet escape when every girl is safe. She doesn't have to be afraid. How long can we turn our heads and give in to ignorance? How long will we close our eyes and tell ourselves it's compromise? I know there's a strength in us that will bring us back to love. Bless us all with clarity. See, we're all created perfectly. all just live as one. I'm ready for a change. Ready for the sweet escape when every girl is safe. She doesn't have to be afraid. I'll give it all my love. I'll give it all I am until the rise lift up, until I see her stand. I'm ready for a change, ready for the sun to rise, ready for the day. I'm ready for a change. Thank you.
Supervisor Wasserman, will you be doing the next number, or?
A junior in high school, people. Thank you. I'd now like to invite Julie Ramirez and Cecilia and staff from the Office of Women's Policy to the podium.
Ooh, it came off.
Come on up. Hey there. How about that, huh? How about this, huh? Awesome. And Emma, we have a commendation here to present to you on behalf of the county and all the effort that you're putting into helping women worldwide. There's a microphone built in.
Okay. I just want to say that I'm so grateful to live in a community and be surrounded by people who support the work I do. I'm so grateful to my family and my mom, especially. I'm very lucky and very fortunate to live in a place that encourages my efforts for Let Girls Learn, and I hope that one day all women will be encouraged in their efforts to make the world a better place. Thank you.
Thank you. Julie?
On behalf of the Office of Women's Policy, Emma, you shine and you exemplify the leadership skills that we're trying to cultivate in today's young generation, and you've given us a fine example to highlight here at the office today and really for your generation for years to come. Congratulations on all the work you do. And this is for you.
Thank you both very much.
Thank you for having us here.
Thank you. My pleasure. Thank you. You get a picture? Whoops, one picture. Take a quick picture. Thank you. Put you in the middle.
Okay. Should I set this down?
Sure,
Absolutely.
absolutely.
Okay.
Take the microphone.
Sure. Thank you.
Oh, accommodation coming in. Excuse us, we don't practice. We don't practice. Thank you. Take care.
Let's say thank you one more time. All right, board members, that brings us to item number 8, which is to consider recommendations relating to certificates of appreciation, commendation, and proclamations. These are items 8A through H, and I'm hoping this goes well because item 8A is to adopt the commendation for Emma Gersten, who's just been handed a plaque, so no pressure on us. Could we ask the clerk to please display the voting panel? She has done so. Supervisor Chavez has moved approval. Supervisor Cortese has seconded the motion. If all 5 members will please vote on their screens. And I believe we have 1 member who's had to step away, but if we could ask the clerk to please display the results on the overhead. The motion carries 4-0, and the various certificates of appreciation, commendations, and proclamations have been approved, which takes us then to item number 9, which is a presentation which has already been conducted. So that then takes us to items 10 and 11, and this is my opportunity to step away from the dais for a moment and up to the podium there to present proclamations for both National Nurses Week and for Emergency Medical Services Week. So, let me say how pleased I am to be able to present this first proclamation, which is celebrating National Nurses Week. I want to ask Laura Brunetto from our Public Health Department and Jill Sproul from our VMC operation to come on up and join me. So, good women, would you come on up, please? And why don't you give them a welcoming round of applause as well. Every year, we celebrate National Nurses Week from May 6th, which is National Nurses Day, through May 12th, which is the birthday of Florence Nightingale, the founder of modern nursing. And we do that in part because as an organization that employs hundreds of nurses in the course of providing care to hundreds of thousands of county residents, we take this time to recognize the importance of nurses in particular to our mission. Every day, and I think many of you know this, our nurses are working on the front lines of the healthcare system. They're administering life-saving care to folks who are in need, but they're also making the public's life healthier through the work they do. I think we all know that healthcare isn't getting any simpler or easier anytime soon. And in fact, as I spend my time here at the county, I am struck by the fact that the arc seems to be bending more and more towards more complex and specialized care, which will continue to elevate the role of nursing in care coordination and delivery. For these reasons and so many more, we want to recognize our nurses across the county today, including those in our own departments, which, as I've mentioned already, include VMC, behavioral health, public health, custody health, and social services. On behalf of the Board of Supervisors, I want to say, if nothing else today, thank you. Thank you to all of the nurses who are providing high-quality care to those in our charge. And at this point, I want to turn it over to Laura and Jill, who I hope will have a few words more to say about the good work our nurses do. Good women, come forward.
I wanted to thank you for this opportunity. I think I have been working in our health and hospital system for about 28 years now. And it started out in the hospital and moved over to public health and have been there for a long time. And I just think it's the most rewarding work to be able to do, to be able to provide prevention services out to our community and to really try to be an integral part of the work we do in the county.
And I'm Jill Sproul, also a longtime county employee. I started here long time ago. I'm losing track of the years. But I just want to take this opportunity to say how proud I am of the nurses across the county and publicly thank each and every one in various, from the hospital to public health to custody, mental health, and to say on behalf of the nurses, it's really an honor and a privilege to care for the citizens of Santa Clara Valley. So thank you so much, and we appreciate your support.
Thank you again, and please do convey our thanks to the hundreds and hundreds of nurses that we want to thank with this recognition. Forgive us while we turn our backs to you for a moment. Thank you again, and at this point, I want to transition to the opportunity to thank our EMS workers with this next presentation, which is of EMS Workers Week proclamation, which designates May 20th to 26th, for those of you who do not have this marked on your calendar, as Emergency Medical Services Week here in Santa Clara County. And let me ask our EMS Director, Jackie Lowther, to join me. Jackie, would you please come forward and give her a round of applause and welcome. During EMS, Emergency Medical Services Week, we try to take the time to recognize our public safety professionals. These are the people who respond to those most in need in a time of crisis. And I think the numbers may startle you, but our county's EMS system responds to more than 125,000 medical emergencies each and every year. They transport more than 80,000 patients to local hospitals. And these responses are carried out by 750 paramedics, 3,000 EMTs, 20 EMS field supervisors, and 125 registered nurses. So when you dial 911 in that moment of emergency, there are so many folks who are indispensable in that life or death moment. These are the highly trained EMS professionals that provide the critical emergency medical care that we count on around the clock, every single day, without interruption. And for that reason, we are particularly pleased to be able to recognize the contributions of our EMS responders today, who are out there keeping the people in our county safe. On behalf of the Board of Supervisors, I want to say thank you to and through Jackie to all of the folks that I'm talking about today for their dedicated service. Now I want to turn it over to Jackie for just a moment to say a few more words about our EMS professionals before we do the official ceremonial handing over of the plaque. But please, it's about taking time to stop, think, and appreciate and value the indispensable life-saving good work these people do. Jackie, please come on up.
I just want to thank everyone. I've been with the county since 2010, not as much tenure as my friends, but I do want to thank all of the first responders for the dedication, the professionalism that they do 24/7, 365. It is remarkable what they do, and I want to thank all of our stakeholders, the hospitals, firefighters, the nurses, the doctors, for everything that they do to take care of all the people of Santa Clara County. Thank you.
Thank you. And bear with us yet again, if you would, please. Why don't you hold that? Look at the nice one. Okay.
Thank you.
Thank you so much. One more round of applause, please, for all the EMS professionals. Now, this next part's going to be a little improvisational, so we're going to ask you all to just work with us a little, help us out. Supervisor Ken Yeager, you are the chair of the Health and Hospitals Committee, and so I want to ask you to come forward and help us with the recognition of a very important 25th anniversary, and I'm going to let it go at that for the moment.
Thank you, President Smidian. For the last 5 decades, community health centers across the nation have delivered comprehensive, high-quality preventive and primary health care to patients, regardless of their ability to pay. These centers are very important in every community that has them, but they don't always work as closely or actively with the local public hospital system as ours do. It's this collaborative spirit that has helped Santa Clara County be leaders in so many different health initiatives over the years. 25 years ago, Community Health Partnership of Santa Clara and San Mateo counties was established as a consortium of local community health centers. Since their incorporation, they have maintained a long and robust partnership with Santa Clara County. Their collaboration with the county, specifically its health and hospital system, including VMC, has led to the creation of an innovative health care system that includes primary care, behavioral health, and disease prevention. Now, CHP's community health centers and clinics serve approximately 240,000 patients. That's 714,600 patient encounters across 39 clinic sites. CHP has been an instrumental partner with the county in response to managed care, specifically with the creation of Santa Clara Family Health Plan, the Healthy Kids Program, and the Primary Care Access Program, which together ensure that virtually everyone in Santa Clara County can obtain health coverage. CHP is absolutely essential part of our local health care safety net, with 34% of their clientele having no health insurance. In recent years, you have played an important role in helping this county really lead in implementation of the Affordable Care Act. You've been central to outreach and enrollment efforts. You've expanded capacity to meet the growing demand. You've utilized Measure A investments from the county to make important improvements in patient-centered care. and I deeply appreciate this partnership. I'd like to present this commendation to Community Health Partnership of Santa Clara and San Mateo counties for its 25 years of dedication to ensuring that our residents have high-quality, accessible, and culturally appropriate health services that lead to improved health outcomes for our entire community. And President Smidian, we turn it over to the next supervisor, is that correct?
So, in honor of this 25th anniversary, you may have noticed that there are some folks here with cameras who are paying attention. They've asked if each and every one of us would share just a couple of words, and I'm going to be calling on Supervisor Chavez next, just to give her a heads up. But what I wanted to share with you all today is that the Community Health Partnership means a lot to each and every one of the 5 supervisors, but perhaps more importantly, much more importantly, Community Health Partnership is indispensable to the 400,000 people in each of our 5 districts, the 2 million people who call this county home. Now, some of you may have heard the technical jargon and wondered, what does it mean to talk about a system that's patient-centered? Well, in the case of my district, it means that there's a community health partnership on the ground that is really focused on the patient first and foremost. And when we toss around a term like a medical home, it means that because there's a community health partnership, there are people there who are providing that medical home for the people that I represent. And when we talk about the triple aim, and I promise that's the last medical jargon I will share with you today, the triple aim is making sure that patients have a good experience, that they have a good, healthy medical outcome, and that we manage the costs as part of the process. And that's what Community Health Partnership is doing each and every day. My colleagues are tired of hearing me talk about the fact that my district is the only one of the 5 supervisorial districts that does not have a county health clinic there. Well, that's why for me and the 400,000 people I'm privileged to represent, Community Health Partnership, folks like Mayview, are indispensable to the work that we do as a county and that our constituents need on a daily basis. So I want to add my congratulations and thanks on this 25th anniversary. And now I want to ask Supervisor Cindy Chavez if she'll join us here so that we can add her comments to the roll. Supervisor?
And I appreciated the get ready. Well, good afternoon, everyone. This is really an amazing anniversary, and I want to say happy anniversary, and really to each and every one of you who provide these services. And let me just say 2 things about the community clinics that are wonderful. One, unlike Joe, I have a lot in my district, and I'm not saying that in a selfish way. I'm saying that in the sense that I have a lot of people who have high need in our communities, and one of the only ways we can reach deep into our neighborhoods is making sure that these clinics are available. So thank each and every one of you. You do a brilliant job of leveraging resources and partnerships so we can address domestic violence, learning about issues relative to education, making sure that every child has eyeglasses. I mean, you are our deep, meaningful partners. And then the second thing I want to say is advocacy. You know, for every single one of these clinics, they love their neighborhoods and they love their patients so much that they are the best advocates that we could have. Congratulations and happy anniversary.
Thank you very much. Supervisor Cindy Watson.
Want me to stay? Oh.
Come on up. And then we'll go to Supervisor Dave Cortez. We'll let him be the closer.
Thank you. I too am honored to be here today and to be honoring Community Health Partnerships. And what a perfect name. You know, community partnerships, it's a collaboration. It's part of what we do here in Santa Clara County. I know the county supports over 210 community-based organizations to provide services because no one of us could do it. But when I see the name Community Health Partnership, that sounds good to me. When I hear 25 years, I say congratulations. Their member community health clinics provide vital and geographically accessible health care to South County residents. But we call South County Morgan Hill, San Martin, Gilroy, that area. And they include Gardner Family Health Network, RhodaCare, Planned Parenthood, Marmonte, and School Health Clinics of Santa Clara County. CHP has worked with my office to ensure that South County VMC personnel and community health center staff are trained on immigrant rights and legal resources. utilizing the Know Your Rights information. So on behalf of my district and just one of 5 county supervisors, thank you very much, Community Health Partnerships, for all you do.
And Supervisor Cortese, will you close us out?
Well, that's all I'm going to do is join the rest of the Board of Supervisors here, the rest of my colleagues, in congratulating and thanking Community Health Partnerships for 25 years and for doing everything that they can to extend the reach of the safety net and the services that Santa Clara County is charged with delivering. Thank you.
Thank you. Supervisor Yates?
Dolores, so we have the commendation, so I don't know if, please, yes, absolutely.
We would like this to be inclusive. Everybody who would like to be part of this next acceptance and photo, please step forward. And as you come forward, since you are the people who are doing the good work that we have been talking about for the last 25 years, you've been doing the work we haven't been talking about it for the last 25 years. How about a round of applause as thanks for all this extraordinary work?
Good afternoon, everyone. My name is Dolores. I'm with Community Health Partnership. I'm the CEO. Next to me are a group of members, clinic CEOs, as well as member of my board of directors. And of course, my deputy director, Elena, who's been with me since 2011, Dr. Imai. The 3 of us have built this organization, rebuilt this organization over the last 7 to 8 years. Supervisor Ken Yeager, thank you very much, and the board for this wonderful acknowledgement of our 25th anniversary. Thank you for bringing out the value that we bring to this community. Special thanks to each board member and to Dr. Smith, who will be, Dr. Smith, you'll be delivering, where is Dr. Smith? He's hiding back there. But I know the 5 board members who took the time to deliver individual commentary. That's very unusual, and I thank you for that very much. So on behalf of the CEOs of our clinics, it has and continues to be an honor for me and the board of directors to work in such close partnership with Santa Clara County for a quarter of a century. I thought that was more impressive than just 25 years, a quarter of a century. Together, in all seriousness, we have accomplished much on behalf of our safety net, and we look forward to the next 25 years as we continue to enhance our system of health care, which includes mental health and behavioral health, primary care, etc. So again, thank you very much for joining us today, and very special thanks to the Board of Supervisors and the county.
Thank you. Thank you. I know the cameras are there. I don't normally turn around and take a picture, so I don't know what you want to do. All right. Well, here's the commendation, and again presented and signed by all 5 Board of Supervisors. And then at this point, we're going to turn around and take a picture on that side.
Would it be okay if I step?
Of course.
Yeah. Okay. So,
Take a picture or just be in the
just
picture?
to come up to be in the picture.
It's fine.
Is that okay? Great.
Whoever you'd like.
Okay, staff of CHP, can you come up, please, quickly? Well, I want to be next to Mr. Yeager. I'm going to be right here. Sir.
I'm going to stand in the back because I'm nice and tall, and I'm going to give us a tighter shot. Dave, I feel like you're in San Benito County out there. Yes, you do. Thanks. There he is.
Wide lens.
Thank you all. Thank you. Next up on our agenda is the presentation declaring April 2018 as STD Awareness Month. Supervisor Yeager, if you are ready to do the honors, and that will be followed by the presentation for Mental Health Awareness Month.
Thank you again, President Smidian. We have made great strides to address and reduce the prevalence of new HIV infections while retaining HIV-positive individuals in care and addressing the stigma around HIV and AIDS, thanks in part to several people that are in this room and the Getting to Zero initiative. Sadly, we often overlook other sexually transmitted diseases as a thing of the past. Awareness months like STD Awareness Month highlight just how far that is from being true. While new HIV infection rates are on the decline, new STD infection rates are on the rise. Over the last few years, I have championed additional funding to see that we address this issue. One of the first things we did was to hire a new STD HIV controller. That's Dr. Lewis, who is with us today. Dr. Lewis, where are you? There you are. Last year, I worked to secure additional funding to increase testing and treatment hours, not only for HIV, but for all STDs at the Crane Center, the sexual health clinic run by our county public health department. Additionally, public health staff have boosted outreach and remote testing services at events in communities determined to be at higher risk. Unfortunately, the largest high-risk group is youth under 25 years old. 1 in 2 sexually active youth contract an STD by the time they are that age. The primary reason for this is the lack of awareness and regular testing. To discuss more about the importance of increasing awareness about the risks and stigma associated with STDs, we have our very own Dr. Sarah Lewis to tell us. Thank you.
Thank you. Well, I'm so grateful to be here, and thank you, Supervisor Yeager, to have this opportunity to talk about both how important sexually transmitted infections still remain today in this community and the invaluable work already happening in Santa Clara County that we're doing to address these infections. So while we've seen some really heroic efforts around HIV prevention and control and care for people living with HIV, we haven't seen the same great successes with other infections. And bacterial STDs like chlamydia and gonorrhea and syphilis, while these can be easily tested for, easily cured with antibiotics, we are still seeing rising rates across the entire country, across all of California. And here in Santa Clara County, we've even seen the rates of gonorrhea and syphilis nearly quadruple since 2010. And these rates are rising among all genders, among all age groups, among all racial and ethnic groups, although the impact is falling disproportionately on our youth, as Supervisor Yeager mentioned, and among communities of color and LGBTQ communities. And last year, the rate of gonorrhea among Hispanic residents of Santa Clara County was more than double that of white residents, and the rate among African American residents was more than 5 times that among white residents. And without timely diagnosis and curative antibiotics, these infections can result in infertility or chronic pain or even lifelong disability, blindness and deafness and stroke. And because syphilis can be passed from a pregnant person to a gestating fetus, with the rising rates of syphilis in adults, we're seeing rising rates of congenital syphilis, which can also lead to pregnancy loss or disability or even neonatal death. Now, fortunately, here in our county, we have a history of dedicating ourselves and our resources to tackling difficult issues that impact our community. And we have champions like Supervisor Yeager and community organizations like Project More, who you'll be hearing more about in a moment. And with these groups, we're already underway with efforts to bend the curve of rising STDs, to understand the trends better, and to tackle them at every layer of how they affect us. But one of the most important efforts we're going to make is to raise youth awareness of how to prevent these infections and how to access testing and treatment when youth become sexually active.
So that's why I'm so proud to be here today to recognize some of the youth who are here with us, including folks like Ms. Gerson, who we heard from at the beginning, who have followed the example of the Santa Clara County leadership before them and already started to dedicate their time and effort to making positive change in our county. So I'll hand things back over to you, Supervisor Yeager, to tell them about your achievements.
Well, thank you, Dr. Lewis, and thank you for all the great work, don't go too far, that you've done here in the county since you've come. I thought it was a real testament to people wanting to work at Santa Clara County that we attract people like you and that we really recruit from the best across the nation. So thank you very much. One such way that the Public Health Department has worked to increase youth awareness is by encouraging youth participation through initiatives like the viral video contest. And our students here, if you want to come on up, yes, you do. You have to come up. That's the only way you get a certificate. For the past 2 years, Public Health has worked with Project More Foundation, a local nonprofit, to get increased student contest participation and increase general public awareness about STDs and the local services that are available. The contest gives high school students an opportunity to produce their own shorts, but by compelling public health video, which highlights the risks, that reduces the stigma around STDs, or highlights the importance of safe sexual health practices like regular STD testing. The top 3 winners and their high school advisors are here today. The advisors are here as well. If you want to come up too, they are here today.
No, also mandatory advisors, please come forward.
Whose videos are being promoted on social media throughout the month. They have won a cash prize for themselves and their schools and will receive a small lunchtime party for their friends in the coming months. The winners are Gabrielle Wilder and Caroline Sakith from Freelance Academy and Leanne Liu from Fremont High School. So let's give them a round of applause. The advisors want to say anything? The students want to say a few words? Come on over. Come on over.
The students are the stars. So come on. Is there any way to show the videos?
No, we won't be doing that, but...
That's the whole point.
Yeah? All right, well, a silent group. So we'll go ahead and, why don't we turn around and take a picture? So I'm going to get in between everybody. There you go. You've got those. There you go, that one. There we are.
Thank you all again for all of your good work.
Congratulations.
And now it's my pleasure to ask Supervisor Cindy Chavez, our board vice president this year, to present the proclamation for Mental Health Awareness Month this year. And because I regrettably have to step away in just a few moments, she will also assist with the presentation of certificates of appreciation to Employee Excellence Award honorees. Supervisor?
Thank you. I'm going to invite up Elisa Koff-Ginsborg. And Elisa is the Executive Director of our Behavioral Health Contractors Association. And I want to invite all the behavioral health community members that are here to come on up. This is the time, Kathy. Don't make me call you up by name, but I will. A Momentum for Mental Health, Asian Americans for Community Involvement, the Law Foundation, Alum Rock Counseling Center, Asian American Recovery Services, Uplift Family Services, Pathway Society, Community Solutions, NAMI, Peninsula Healthcare Connection, Gardner Family Care, and Hope Services, and anybody else who I left off on my list. And if you are wearing a green ribbon, you know who you are. And Tony Tully's. I know Tony was here. If I could ask Tony, our mental health, behavioral health director, and also Renee, just because Renee's telling other people to come up. Renee, come on up. That's what happens. No, I'm just kidding. So the reason that we're asking these folks to come forward today is they do incredibly important work. And we are, in celebration and honor of their work, dedicating May 2018 as Mental Health Awareness Month in Santa Clara County. And you'll notice that these, I think we're all running out of colors, but we have a beautiful color to represent behavioral health and to remind people of this important month. The County of Santa Clara partners with any number of service providers who address and alleviate the symptoms of mental health conditions and promote mental health and wellness throughout our county. And we're so grateful to all of these providers who are supporting some of the most afflicted people in our community who suffer from mental health challenges. These are not just partner organizations, but every one of these organizations has played a leadership role in the safety net of our community. Effective mental health awareness strategies work to reduce and eliminate the stigma, and that's so important because people sometimes are so embarrassed or so afraid that they don't come forward and ask for help until sometimes it's just too late. So through education and collaboration, these nonprofits work day in and day out, along with many county employees, to support the lives of individuals and families affected by mental health. So today we're calling upon all of our community organizations to acknowledge this important health challenge in our community, and we're just so honored to have all of these nonprofits. Give them a round of applause. They do amazing, amazing work. And if I could, I'm going to, Elisa, are you going to be our spokesperson? All right, well, let's call up Elisa Kofkinsborg.
Thank you, Supervisor Chavez, and to the board, and Dr. Smith, and Renee, and Tony. We know that you share the strong commitment that all my colleagues from all these agencies hold to supporting people living with mental illness in our county. As you said, stigma can be very dangerous and very isolating and is one of the biggest challenges. And today, by wearing the green scarf and the green ribbons, and NAMI has one for all the board members and administration, and by shining the light on mental health, you're sending the message to any child or teen or adult or senior who is feeling isolated or lonely or helpless that they're not outcast, that there are services, that they're embraced, that our county values them, and that our county believes in everything they can do. So thank you for engaging all of us in that today.
Thank you. Let's give them a round of applause.
As the director of the department, these are all of our providers behind us, and I see staff out here in the green ribbons. So it's an honor to be the director of this department. It's an honor to work with these providers. It's also an honor to have such strong board support and administrative support for this very important work, including our work with the officers as well. So I'm very proud to stand here with all of my colleagues today. So thank you.
Gather in. If there's anybody else who wants to jump in the picture, just get him back. Photo bomb. We're gonna all just. You're wearing a ribbon, and I saw the Indian Health Center and some other folks. So come on up. All right.
One, two, three. One, two, three.
All right. You get us really organized. Where to go? Okay, squish. We can do that.
There's this thing.
Oh, here, we'll move that. Yeah. Let's take freedom right there. Move the upper part of that.
Thank you all once again, and as the hugs continue, we're going to ask our County Executive, Dr. Jeff Smith, to step up to the podium, please, for the presentation of the Certificates of Appreciation for Employee Excellence Award honorees for this month. And again, I'm going to thank my colleague, Vice Chair of the Board, Cindy Chavez, who's going to assist with this, as I am obliged to step away from the dais. Thank you. Dr. Smith, the podium is yours.
Thank you, Mr. President. Well, such excitement. We've had a lot of great things going on today already. Maybe it portends a great meeting tomorrow. I hope so. Now we have one of the most exciting parts of the month, and that's our time to give our Employee Excellence Awards to 7 of our great employees out of the 20,000 that work for us, that do fabulous work every day, toiling, oftentimes without much recognition, providing fabulous services to the people of this county. So this is our small way of trying to give some recognition for all of the people involved in working for this county. So would the 7 award winners please join me up here on the dais to my right and to my left in the chairs here. Come on. Okay, so have a seat, and the way this is going to work is I'm going to call out your name, and you come up and stand by my side while I read a little bit about you that's written by your supervisor. I did not compose these myself, so any complaints go to the supervisor. I'll take all the credit. No, just kidding. And then once we've done that, we will have you go back to your chair, and then after everybody's done, we'll turn around and get pictures. Before you go back to your chair, go check in with Vice President Chavez, who has your plaque and your award and your financial compensation. Okay? And for the audience, feel free to yell and scream and clap for everybody or for your particular choice employees, realizing that we have to make a lot of noise to let all 20,000 other employees know how fabulous these people are who are representing them. Okay? All right, well, first of all, we have absent today a couple of award winners. Lizette Alzandua, who is a justice clerk in the Office of the Public Defender, is unable to meet or unable to be here. And also Andres Gonzalez, who's a correctional deputy in the Custody Bureau. He will be getting his award in June. So just a round of applause for the two of them. They couldn't be here. So, Jesse Valencia. Jesse's a telecommunications technician with ISD, well, now called TSS, and he's been with us for 12 years. Jesse exemplifies great service by understanding the needs of our customers and doing his best to ensure that issues are resolved in a timely manner. He makes every effort to satisfy our customers' needs and shares resolutions with the team, improving everyone's knowledge of the issues involved. Jesse always demonstrates ethical conduct, reflecting honesty and integrity in everything he does. He treats all that he meets in an equal manner, no matter who they are or what they need. Coworkers know they will always receive timely and knowledgeable answers from Jesse, adding to his standing as an ideal teammate. He values his community and gives back by participation in his church on weekends, and he is also a mentor. Congratulations, Jesse. Alejandra Espinoza. Deputy Espinoza is a detective in the Office of the Sheriff in Investigations, and she's been with us for 12 years. She is currently assigned to the General Crimes Unit in South County. As a detective, she has handled a variety of cases ranging from property crimes to violent felonies. Recently, Deputy Espinoza was assigned a high-profile carjacking attempted robbery case. During this case, she worked alongside detectives from numerous police agencies to identify the suspect and track his significant crime exploits. Through her investigation, it was discovered that the suspect was responsible for additional crimes, including sexual assault. Due to Detective Espinoza's diligence, the suspect was charged with numerous felonies, including robbery, theft, battery, and sexual assault. Annually, she represents Santa Clara County at the Latina Role Model Conference sponsored by Overfeld High School, where she positively promotes the Sheriff's Office to young members of the community. Deputy Espinoza is married to her high school sweetheart, Abraham. Where's Abraham?
Oh, over there. He's back there.
You're supposed to know where he is.
Well, my kids are there. I thought he was with my kids.
All the time. Okay, they have been together for 18 years, have 2 children, and enjoy playing with them on the weekends and mentoring them as they grow. Thank you very much. Mark Nguyen. Mark is a Deputy Probation Officer 3 in the Probation Department, Juvenile Probation, Placement, and Foster Care, and he's been with us for 11 years. In 2016, Mark played an integral part in reducing the number of youth entering placement by over 40%. Wow. This reduction allowed families to benefit from services and nearly eliminated the need to place youth into congregate care. Mark's knowledge of the placement process ensures participating youth experience only a minimal trauma during their acceptance interviews. Mark builds rapport with youth and encourages them to become engaged in their own rehabilitative processes. Recently, Mark was observed offering guidance to another placement officer regarding a direct route of travel by mapping each site, thereby minimizing the amount of time and mileage necessary to complete each visit to their client. This observation demonstrates Mark's personal code of ethical conduct, honesty, and his ability to operate at the highest levels of integrity. The time and effort Mark dedicates to the safety and well-being of our foster youth clearly demonstrates his commitment and value to the department, the client, families, the community, and the county as a whole. Congratulations, Mark. Good job. Great job. Rajni Shah. Did I get it right? Social services is always the loudest. They are. Rosny is a senior research and evaluation specialist with the Social Services Agency, Department of Program Support, Research, and Evaluation. She's been with us for 3 years. As you can see, Rosny has an infectious smile, brightening everyone's day when she enters a room. She's always willing to support and educate program staff in the agency office and in her role of supporting the Department of Adult and Aging Services. Aging and Adult Services, sorry. You can see I'm getting there quick. Rajni goes out of her way to explain the evaluation process, ensuring that everyone she supports understands the needs and the goals of the projects and initiatives that are helping all become more informed. Her passion is effective communication and thoroughness. It is obvious to staff that she cares about the work she is doing and the families whom she is impacting. Recently, she presented the initial findings from the Intern and Earn program evaluation project from last summer. The manager reported that her team left re-energized and motivated, all due to the way Rajni presented the findings. Thank you for your efforts in making our clients feel heard and be responsive to their needs. Congratulations, Rajni. Irma Alcaraz. Irma is a quality improvement manager in nursing at Valley Medical Center Nursing, and she's been with us for 2 years. Irma has served as a nurse in the public sector for over 13 years, and she is dedicated to our mission to provide high-quality, compassionate health care for all. She provides outstanding public service through participation in many formal and ad hoc committees that impact the care and outcomes of our patients. Each day, she interacts with the frontline nursing and ancillary staff, listens to their concerns, guides their practice with compassionate and expert advice. Irma helps to remove barriers to provide superior patient care. She co-leads unit-based teams, chairs the Nursing Pharmacy Medication Safety Committee, and meets with bedside nursing safety champions on all shifts. Does anybody else do anything? She ensures the concerns and challenges raised by any coworkers are heard by the leadership. She is the first to look for system-related issues when analyzing quality matters and is a staunch proponent of just culture. Her fairness, integrity, positive attitude, self-confidence, and calm demeanor make her an excellent role model. On a personal note, Irma is married with 2 young children, and she's pursuing a master's in nursing. Congratulations. How old are your kids? 7 and 5. All right. A 7 and a 5-year-old at home and doing all of that. You guys overwork her. Shelley Barberi. Okay, so behavioral health had to prove me wrong. All right, Shelley is a program manager too with the Behavioral Health Services Supportive Housing Services for 2 years. Shelley demonstrates exemplary public service through her strong leadership and commitment. She manages an extremely complex system of care that works to remove barriers and provide housing and services for the homeless in our community. Her work with the Housing 1000 campaign made her a leader and forerunner in the county's care coordination project. As the permanent supportive housing matchmaker, Shelley connects resources and services to the homeless individuals. She demonstrates a strong commitment to ethical conduct by ensuring that stakeholders adhere to policies and procedures, as well as eligibility criteria set forth by the county's coordinated assessment system. For the past few years, Shelley and her family have been focused on health and fitness. They prepare healthy meals at home and engage in new sports and exercises. At work, she often volunteers to be a walking buddy or healthy lunch exchange buddy. You guys have a healthy lunch exchange? All right. As a lifetime resident of Milpitas, she pays attention to the civic issues that impact her town, and despite her busy schedule, is actively engaged in community events and fundraisers. Congratulations, Shelley. Louis Toma. We're going to have to get an applause meter around here. Louis is a program specialist too in County Fire and works in the Office of Emergency Management. He's been with us for 2.5 years. Louis has distinguished himself as a steadfast emergency manager, primarily through his constant leadership. Louis spearheaded and developed the county's first heat annex and was instrumental in the creation of the Disaster Cost Recovery Annex, which has been heralded throughout the state as a best practice. He wrote a highly touted social media policy that has been duplicated by many county agencies. Additionally, Louis created a technology situation awareness guide for the Super Bowl 50, and still it is used today. His commitment to the field of public safety in the Bay Area community was evident while he was deployed to the Sonoma fires. Louis provided expert guidance to the Sonoma County Emergency Operations Center personnel for 5 days, serving in a variety of roles, which included Situation Status Unit Leader, Damage Assessment Unit Leader, and Planning Intelligence Section Chief. The impassioned contributions of Louis reflect strongly upon him. County Fire is pleased to have Louis honored today, and he is constantly thought of as an excellent employee. Congratulations. Louis' cousin was a physician who worked for me with exactly the same name a few years ago in a previous life. Great family. Okay, so one last round of applause for everyone. I'm sure you'll agree with me that they're a fabulous representation of our 20,000 employees. Congratulations to all of you. You certainly deserve it. And we're going to turn our backs to you for a little bit and take some pictures, but you're still welcome to laugh and scream and clap and be happy. Everybody in a semicircle.
Congratulations on your work. Congratulations to you. Congratulations.
Congratulations. Mark, you got to send it. Really. Thank you. Send it to Diane.
Good job.
All right, let's give one more round of applause and some hooting and hollering for these great employees. We are adjourned until 9:30 tomorrow morning.